Hello and welcome. I am Mara Cepeda. This is Rappler Talk. We are here today with the new Department of Health Secretary, Dr. Francisco Duque III. Hello, sir. Welcome to Rappler.
Well, good afternoon to you, Mara, and it's a pleasure to have this interview with you.
All right. Sir, this isn't the first time that you've been assigned to the Department of Health since you were the DOH chief of former President Gloria Arroyo. How does it feel to be back at the department?
Well, it's great to be back with probably even more challenges, more difficult issues to address. But the DOH as an organization has proven itself to be very effective in addressing difficult health challenges. So it's no surprise for me to work once again with them and deliver the same quality of results.
Sir, how was the position offered to you by Malacanang? Was it the president who offered the post to you, or one of the cabinet members?
Well, it's the president through a special assistant to the president. They were together at that time, but it was forwarded to me, the message of the president, for me to take on the secretaryship of the DOH.
Personal meeting ito, sir, or through text message, email?
Sa telephone.
Telephone.
Yes.
Opo. How did you feel, sir, when the post was offered to you? Did you have any apprehensions in accepting the post again?
Well, you see, that was not the first time that I was offered a job by the president. The first time was in January 8 this year, when he offered me to become the chairman of the government service insurance system. So prior to this second appointment, I had that first one. And so it wasn't difficult naman for me to say yes as a public servant. You know, as the saying goes, once a public servant, always a public servant. So I subscribed to that ethos, and it's nice to be a public servant where you can make a lot of difference, especially in the health sector, which is an important component of social transformation, to provide quality of health to our people, especially the poor. No, it's the poor that really we need to lift from the morass or from the quicksand of poverty and disease. There's a cycle. The more sick you become, the more impoverished you are. The more impoverished you are, the more sickness you experience.
You mentioned about reaching out to the poor more and giving them services to uplift their lives. Now, your new tagline for the department is boosting universal healthcare via Formula 1+. Now, sir, how will the department go about this tagline of yours, considering that providing universal healthcare is not very easy? It's not been done yet in the Philippines.
Well, it's a moving target. It's a vision that we would like to realize, but the difference today is we've set for ourselves a timeline.
Okay.
It's really DOH providing the pathway towards health for all by 2030. And of course, there will have to be some kind of vision-based camps, which I will need to suggest to the ExCom of DOH, that perhaps we can be because the vision is like this: it's a global leader in providing healthcare financing, equitable healthcare financing, more responsive health system, and better health outcomes, with the mission of providing equitable or guaranteeing equitable, sustainable, quality healthcare for all Filipinos, especially the poor, and to become a leader in the quest for excellence in health. Okay. Now, those are the big the vision and the mission with the core values of integrity, excellence, and compassion. What I would like to suggest is really to have a vision-based camp. Say for 2022, we want to be the ASEAN leader in providing the three: equitable healthcare financing, a responsive health system, better health outcomes, and therefore improve quality of life.
So, sir, is this a given that you are supporting the proposed universal healthcare bill?
Well, I haven't really reviewed the provisions of the said bill, but the concept, as I have been told in general terms, seem to be okay with me. So we will be able to intelligently comment on it after my technical working group shall have seen the contents or the provision.
Sir, budget will be a big issue once we implement universal health care. You have previously served in PhilHealth before, and I think the criticism then was the government only provided about 500 million pesos when for the program to work and to really serve indigent Filipinos, you needed 6 billion at the time. So are you a little bit more confident now that there will be budget for universal health care should it push through, especially since you have a 2030 timeline going here?
That's right. Well, let me just set the record straight. During my time when I was PhilHealth president, in 2010, when I stepped down as secretary, the coverage of PhilHealth then was 86%.
Okay.
And if I remember right, the budget to subsidize the premium contribution, the membership of the poor sector, poor segment of the population, was about 5 billion. Not 500 million, but 5 billion pesos.
5 billion.
Yeah. It was close to that, about 4 or 5 billion, thereabouts. So today, we have the benefit of the same taxes being, proceeds put into the PhilHealth to continue the enrollment, to sustain the enrollment of the poor segment of the population and the not so poor. So we have a total of about 45 million beneficiaries.
Okay. Sir, let's go to another topic. You mentioned that, of course, the Marawi rehabilitation will be a priority of your term here. And I think around 3 billion alone was estimated by former Health Secretary Pauline Obial in rehabilitating the health facilities in Marawi. So, sir, so far, what you've learned in your, I think, 2 weeks in the position.
This is my second week.
Second week. What's the situation on the ground? How are people doing in evacuation centers?
Well, little by little, the IDPs have started homeward bound. So they're going back to their residences. But of course, it's not without the aftermath of war, the rubble, the damage that has been inflicted, both infrastructurally and other healthcare facilities. The health system has been affected a great deal. So on the ground, we have been providing public health and medical services, like the provision of drugs and medicines for chronic non-communicable diseases, hypertension, diabetes, the usual, no? And antibiotics for infectious communicable diseases. The psychosocial, mental health psychosocial services, the water and sanitation, hygiene services as well, no? So we see to it that these daily requirements or needs of our people in Marawi are being addressed on the ground by our DOH personnel.
And you will be visiting Marawi.
Yes, I'm going there on Friday.
You mentioned about psychosocial services, and I think not a lot of people are aware that when you're a victim of war, you don't just need basic medical services.
You need to be debriefed. There's what you call a debriefing, psychosocial debriefing, to ease you back into normalcy and to ease you out of the trauma that the war has inflicted upon you psychologically.
How important is the psychosocial support that the DOH is giving to the victims of Marawi, and how does it help them heal? Not just, I guess hindi lang po siya physical wounds, di ba, sir? There are also emotional, psychological wounds. How does it help?
I think it's been very effective. It has been proven that these services that both DSWD and the DOH give have helped a great deal in normalizing or bringing back normalcy to the lives of the affected citizens of Marawi.
Okay. Sir, let's go to medical marijuana because it seems to be a very hot topic. So earlier this morning, you clarified that you are for the use of medical marijuana but for research purposes only.
Yes, for compassionate use and under a research setting with all the strict conditionalities complied with. So the requirement of safety, efficacy, and quality control of how they process these medical cannabis have to be adhered to and complied with the rules and regulations of FDA. So we cannot compromise on that. But you see, the important thing is to frame it in the context of research. And matter of factly, the national policies and mechanisms are already in place for people who need to access the medicinal properties of cannabis in a strictly research setting. So it doesn't mean it's only purely research for certain things that you need to find out in terms of its safety, its potential benefits, its potential hazards or risks, but also where there is a clear indication. And I think there have been studies to show that to a certain degree, the byproducts of medical cannabis, or the end products, I should say, or its derivatives, the THCs and the cannabinoids, are found to be somewhat effective for symptomatic treatment of anorexia in HIV/AIDS, of nausea and vomiting in cancer chemotherapy, alleviation of pain also for certain types of cancer, and also for certain types of seizures. And so it's not definitive. I mean, it's something that has yet to be further looked into and studied, because those research outputs have also included the potential risks or side effects.
What are these potential risks, sir? Because you also mentioned this morning that you believe that the risks far outweigh the benefits.
Well, it looks like, based on the readings of certain literatures, that the potential risks are as follows. Number one, it can cause impairment of your psychomotor and cognitive functions, especially through chronic use. Obviously, it can lead to drug addiction or dependence. And then it can also cause alterations in depth perception. So yung malapit parang malayo, yung malalim parang mababaw. So when you drive, for example, it can cause a fatal, if not serious, motor vehicular accidents. So and then not withstanding the fact that it's if you smoke marijuana, you will also affect your lungs. I think there have been studies, but not sure, don't quote me. Parang lung cancer may also be attributable to chronic use of marijuana, and also cardiovascular effects. So there you are, the many side effects, many potential hazards or risks.
But you're very you're open, sir, to what will become of this bill in the House. And you've read to read it, I believe, sir.
Yes, we will need to read it, but also the earlier statement by Director Ivan Escartin of the Dangerous Drugs Program, when he said that, again, underscoring there is in Section 16 of the Comprehensive Dangerous Drugs Act of 2002, that's there. It says,
Yes,
you know, the provision is there, and then the statement of policy is also there. So the Dangerous Drugs Board, by law, has to, and already crafted the IRR, no? So I think Congress has to look at the law and the implementing rules and regulations.
To make sure it's not redundant.
Yes, it's not redundant kasi kung hindi, sayang naman ang resources to repeat what has been done.
Okay. Sir, I'm not so sure if this particular news reached you, but prior to your clarification today on your stand on the medical marijuana, or I guess the DOH stand on the matter, CA Assistant Majority Leader Tito Soto was quoted as saying na, and let me read na, if he thinks medical marijuana is true, kalimutan na niya ang CA. And I think that's because I think some reports said that you were for medical marijuana pero wala pa po atang clarification on your end. So are you nervous about your chances in the commission and appointments, considering also that your predecessor was rejected by the CA?
Well, let's put it this way. The issue on medical marijuana is not the entire health sector issue. There are many equally important issues. So I guess, number one, we welcome the comments of Senator Soto with respect to his position that there already is a law to that effect, and so that must be implemented. So it is really the call of the policymakers, and in this case the legislators, no? And we at the executive branch of government are here to execute or to implement the law.
You're ready to face the CA?
Yeah, we're ready to face the CA. We'll answer it the best possible way, and I hope it will be to the satisfaction of the members of the CA.
Okay. So we're down to the last few questions for today. You mentioned in your speech before DOH employees during your turnover ceremony to regain the golden era of the DOH, to make it, I guess, the #1 performing agency, and that seems to be a lot of responsibility on everyone in this office. How do you plan to go about that, sir?
Well, we need to motivate the entire workforce and to lead them to the vision. See, you cannot do all of these things without leading the way, showing the way. It's very important to constantly communicate with the organization, with the people in the organization. You don't expect people to just automatically absorb, all these platitudes, all these, all these very excellent vision and mission. It's really how to get there, and there has to be a framework of where you want the organization to be or achieve a future state. So there has to be the hard part, which is really the operations part. So there has to be an alignment. You have the strategic plan, and which we already have. We just need to rehash them, probably tweak them where there is room for improvement. Then we have to have the operational plan to implement, and then with the budget execution plan, and then the human resource plan, all in alignment to be able to systematically achieve the vision and the mission.
What's your long-term goal for the department, especially, or how do you want the department to be recognized under your leadership?
Of course, we want the department to be the #1 performing national government agency And given the huge budget that it now has, 165 billion, if we were able to bring it to number one with our scarce resources or a very limited budget at 10 billion initially until about 34 billion, it only means that the DOH has the capability, has the capacity to provide services that are impactful and can actually be felt truly by our people, especially the poor. So that's what we intend to do with the DOH under the Duterte administration.
So, sir, last question for today. What can the public expect from the new DOH secretary? How would you make yourself different from your predecessors?
Well, I hope to be able to communicate to media, be more open to media, but I hope also that media will be asking questions which are more policy and more strategic. Sometimes the difficulty of the Secretary of Health is when he has to be made to answer very operational, very detailed nuts and bolts of certain issues. But that's okay. We always study and prepare ourselves, prepare myself for that eventuality.
Okay, and that's it. Thank you so much for being with us today, Dr. Duque. There you have it, the new DOH Secretary Francisco Duque III. I am Mara Cepeda. This is Rappler Talk. See you next time.